Hey everyone, Doctor Your Name here. Today we're tackling a topic that can be a little uncomfortable but is super important for your health: gonorrhea. Now, I know talking about STIs can be awkward, but trust me, knowledge is power. Gonorrhea is incredibly common, and the thing is, many people who have it don't even know it because they don't have any symptoms. That's why we're diving deep into what gonorrhea is, how it spreads, and most importantly, how you can protect yourself. We'll cover everything from the symptoms to look out for to the potential complications if left untreated. We'll also discuss diagnosis and treatment options so you know exactly what to expect. Let's get informed and stay safe. Become pregnant, regular STI testing is absolutely crucial. One of the trickiest things about gonorrhea is that it often flies under the radar, making it a silent but serious threat. Many people, and I mean a lot of people, don't experience any symptoms at all. This means they could be carrying the infection for months without knowing. They could be infected and spreading the infection without even realizing it, unknowingly putting their partners at risk. That's why getting tested regularly is so incredibly important, especially if you're sexually active or have multiple partners. Now, when symptoms do show up, they can differ between men and women, making it crucial to know what to look for. Let's start with what guys should be on the lookout for. Recognizing these signs early can make a big difference. One of the most common signs is painful urination. This can be a sharp burning sensation that makes you dread going to the bathroom. You know, that burning sensation when you pee. Not fun. It's a clear signal that something's not right. Another telltale sign is an unusual discharge from the penis. This can be alarming and should not be ignored. This discharge can be white, yellow, or even green. The color and consistency can vary, but it's always a red flag, and trust me, it's not something you want to ignore. Early treatment can prevent complications. Some guys also experience swelling or pain in the testicles. This can be quite uncomfortable and is a sign that you need medical attention. Again, if you notice any of these symptoms, it's time to see a doctor. Don't wait until it gets worse. Now, for the ladies, the symptoms can be a bit more subtle. This makes it even more important to pay attention to any changes in your body. One of the most common signs is a change in vaginal discharge. This could be an increase in discharge, a change in color or consistency, or even a foul odor. This could mean an increase in discharge, a change in color or consistency, or even a foul odor. These changes are your body's way of telling you something's off. Pain or burning during urination is another red flag. It's similar to what guys experience, but it's often mistaken for a urinary tract infection, UTI. It's similar to what guys experience, but it's often mistaken for a urinary tract infection, UTI. If UTI treatments don't work, consider getting tested for STIs. Other symptoms in women include abnormal vaginal bleeding, like spotting between periods and pelvic pain. These symptoms can be easily overlooked but are significant. Remember, gonorrhea can also infect other areas like the rectum, throat, and eyes. These infections can cause a variety of symptoms. A rectal infection might cause discharge, itching, pain, or bleeding. These symptoms can be uncomfortable and should be checked out. A throat infection can cause a sore throat, and an eye infection can lead to redness, pain, and discharge. These are less common but still possible. The bottom line is, if you notice anything unusual down there or anywhere else for that matter, don't hesitate to get checked out. Early detection and treatment are key. Okay, so we've talked about how gonorrhea spreads and the symptoms to watch out for. Now let's get real about what can happen if you ignore it. Because trust me, this is not something you want to mess around with. For women, one of the most serious complications is pelvic inflammatory disease, or PID for short. PID happens when the infection spreads from the cervix to the uterus, fallopian tubes, or ovaries. It can cause chronic pelvic pain, infertility, and even life-threatening ectopic pregnancies, where the fertilized egg implants outside the uterus. Guys aren't off the hook either. Untreated gonorrhea can lead to epididymitis, which is inflammation of the epididymis, the coiled tube that stores and carries sperm. This can cause pain, swelling, and in some cases infertility. But here's the thing. The complications aren't limited to the reproductive system. Gonorrhea can spread through the bloodstream and infect other parts of the body. This is called disseminated gonococcal infection, or DGI, and it's a serious condition that can be life-threatening. DGI can cause arthritis, skin lesions, and even infections of the heart valves or brain. And to make matters worse, having gonorrhea can increase your risk of contracting other STIs, including HIV. That's because gonorrhea can cause inflammation and sores that make it easier for other infections to enter the body. Alright, so let's say you've been experiencing some symptoms, or maybe you just want to be proactive about your sexual health. It's always a good idea to stay informed and take action when it comes to your well-being. What's the next step? Well, the first thing you need to do is see a doctor or visit a sexual health clinic. These professionals are trained to help you with any concerns you might have. They'll ask you about your sexual history and any symptoms you've been having. This information is crucial for an accurate diagnosis. Now, to diagnose gonorrhea, doctors usually use a urine test or a swab from the affected area. These tests are quick and relatively painless. The urine test can detect gonorrhea in the urethra, while swabs can be taken from the cervix, vagina, rectum, throat, or penis, depending on where the infection might be. This ensures that the infection is accurately identified. The good news is that gonorrhea is treatable with antibiotics. This means that, with the right medication, you can clear the infection. The bad news is that we're seeing more and more cases of antibiotic-resistant gonorrhea, which makes treatment more challenging. This is a growing concern in the medical community. That's why it's so important to get tested and treated early on, before the infection has a chance to mutate and become resistant to medication. Early detection is key to effective treatment. Typically, treatment involves antibiotics, usually a single injection of ceftriaxone combined with an oral dose of azithromycin or doxycycline. This combination is designed to effectively combat the infection. It's crucial to take the full course of antibiotics as prescribed by your doctor, even if your symptoms clear up before you finish the medication. Stopping early can lead to complications. This helps prevent the infection from coming back and reduces the risk of antibiotic resistance. Following your doctor's instructions is essential for your health. After treatment, your doctor might recommend a follow-up test to make sure the infection is gone. This step ensures that you are completely free of the infection. It's also important to avoid sexual contact until you and your partners have completed treatment to prevent reinfection. Communication and mutual care are vital in this process. Okay, let's talk prevention. Because when it comes to STIs, including gonorrhea, prevention is always better than cure. It's essential to be proactive about your sexual health. The most effective way to prevent gonorrhea is to abstain from sexual contact. This eliminates the risk entirely. But let's be real, that's not always realistic for everyone. People have sexual needs and desires, and that's perfectly normal. So, if you are sexually active, there are things you can do to significantly reduce your risk of getting infected. Knowledge and preparation are key. First and foremost, use condoms. They are highly effective when used correctly. And I don't just mean during vaginal sex, but also during anal sex. Consistent and correct use is crucial. Condoms act as a barrier, preventing the exchange of bodily fluids that can transmit the infection. They are a simple, yet powerful tool. For oral sex, using dental dams, which are thin, square pieces of latex or polyurethane, can help reduce the risk of transmission. They are easy to use and very effective. They act as a barrier between the mouth and the genitals or anus, providing protection during oral sex. Another important step is to limit your number of sexual partners. This reduces your exposure to potential infections. The more partners you have, the higher your risk of exposure to STIs. It's a simple numbers game. It's also crucial to be honest and open with your partners about your sexual history and get tested together. Communication builds trust and safety. And speaking of getting tested, regular STI testing is one of the best things you can do for your sexual health. It ensures early detection and treatment. Remember, many people with gonorrhea don't have any symptoms, so getting tested regularly is the only way to know for sure if you're infected. Don't wait for symptoms to appear. Finally, if you know someone who has gonorrhea, avoid sexual contact with them until they have completed treatment and have been cleared by a doctor. This is crucial for your safety. This will help prevent the spread of the infection. Prevention is always better than cure, so take these steps seriously. So there you have it, everything you need to know about gonorrhea. Remember, it's a common infection, but it's also treatable and preventable. The key is to stay informed, practice safe sex, and get tested regularly. Don't let fear or stigma prevent you from taking care of your sexual health. Talk to your doctor, visit a sexual health clinic, and get the information and care you need. Thanks for watching, and remember, knowledge is power. Stay safe and healthy, everyone.